Sickle cell. That's a word you've likely heard, but don't know much about. It's a disease that just might impact someone you know, in the office, in the classroom, or in your neighborhood. But you probably wouldn't be able to tell. Why? Because sickle cell is a disease that doesn't necessarily show wear and tear on the outside, but on the inside, it can do significant damage. Damage that can lead to death. But in New York State and in our region, work is underway to breathe new life into efforts that would improve the prevention of complications and treatment of sickle cell disease. Joining me to discuss these efforts and what you need to know about sickle cell is Dr. Susie Nerona, director of the Sickle Cell Transition Center at UR Medicine's Golisano Children's Hospital. Lloyd Davis, a sickle cell survivor and student at MCC, and Lloyd's mother, Simone Stevens, an advocate for sickle cell disease. Welcome to all of you, and thank you for being here. So Dr. Nerona, I will start with you. For those who don't know, what is sickle cell and why do some with the disease feel that they have been forgotten?
So sickle cell disease is an inherited disorder that affects mostly African Americans, although there are people of Mediterranean descent, Indian, and Middle Eastern descent who are affected. And it's a genetic disorder that causes the production of abnormal hemoglobin. Hemoglobin is what makes red blood cells red and carries oxygen throughout the body. And the problem in sickle cell disease is that hemoglobin becomes misshapen, and that causes the red blood cell to change into the so-called sickle shape or C shape. And that shape doesn't flow through blood vessels very well, and it becomes blocked in the smaller blood vessels as well as larger blood vessels. And the problem with problems in the blood is that blood flows throughout the body, and so it can affect every single organ, starting from the brain, the eyes, all the way down to the gallbladder, the liver, the heart, among other things. And unfortunately, this can happen throughout life. It's really a chronic illness, and it primarily causes pain, acute pain and chronic pain. And children start from very young age to have to cope with this, and they learn how to cope and become functional, but in doing so, they may not appear ill. And so they have to find some way to explain to schools, and as they grow older, their employers, why they're not able to go to their jobs or attend school. And it's hard to explain a disease that really doesn't show on the surface most of the time.
And for those who say some have told me they feel as though they've been forgotten, why are some saying that?
Well, part of the reason is that it is a relatively rare disease, and so people don't necessarily know about it. And if you don't know about it, then it's hard to know what accommodations to make for people who suffer from it. And unfortunately, if you don't receive those accommodations, then you may be disadvantaged when it comes to schooling or when it comes to employment.
Lloyd, as a young person fighting sickle cell, talk to me a little bit about how it has directly impacted your life, perhaps in ways that people watching may not realize or may not think about.
Growing up, I guess, school-wise, I oftentimes ended up missing a lot of days of school. So learning in class was pretty hard. I'm not gonna hold, but for the most part, I would be back and forth between school and the hospital, and I would have a hard time gathering concepts that everyone else was learning in class. So I would have to take notes and try my best to stay up. And that's really all you really could do, is try to keep up with everyone else. It's a constant game of catch up.
People watching right now, and they see you, they look at you and say, he looks healthy, he looks vibrant. Was it a challenge for you to have to explain sometimes to your peers and to your teachers what was going on?
Yeah, a lot of people couldn't understand how someone who looks so healthy could seemingly just disappear. There were times when I remember I was gone for a good 2 months or so. But, you know, it's a constant game of catch-up, like I said. They just couldn't understand.
I have talked with people about sickle cell. In full disclosure, my father has sickle thalassemia, so this is obviously a topic of great interest to me. But when I talk with people, they don't realize, and as you said this, they don't get just how severe this can be. They don't necessarily understand the type of pain that can be felt when one has a sickle crisis. And those watching right now, I'm sure the first thing that they're thinking is, well, is there a cure? Dr. Noronha, is there a cure?
So there is a cure. If we were to do a bone marrow transplant on a patient with sickle cell disease, it can theoretically cure that disease. But right now, the best outcomes come from a transplant from a donor who is a fully matched brother or sister. And, you know, I've tested numerous families, and unfortunately, those brothers and sisters are not full matches.
And in terms of treatment options for symptoms, what is available?
So the best known treatment right now is hydroxyurea. So we've had now decades of data, first in adults and then in children, about how it basically it encourages the production of what's known as fetal hemoglobin, or hemoglobin that babies before they are born primarily produce, but after birth that production goes down. So hydroxyurea actually harnesses that ability again, and that hemoglobin works much better than sickle hemoglobin. And so people who take it, people who have severe sickle cell disease are the ones who typically are offered that medication, will experience much lower frequency of pain crises. And there's a very dangerous complication of sickle cell called acute chest syndrome, which is a severe type of pneumonia. Hydroxyurea will also decrease the rates of that complication.
Simone, I want to tie you into this. We heard Lloyd explain some of the challenges, and he says it's a give or take in school and in growing up. As a family, how do you work through and around this?
Just a lot of advocating. I mean, like from the first day of school, trying to meet with doctors, liaisons, teachers, nurses, making sure they're aware without Lloyd being exposed, because the kids do want their confidentiality, and you know, they don't want all their friends to know sometimes. And educating the staff and the people around them makes a huge difference, making them aware what to look for, signs, symptoms. As far as family, it's been difficult at times. You know, I've honestly have lost jobs, you know, because I've had to take off. But, you know, my theory is, you know, this is my purpose. This is my child. So, I mean, basically, some of my jobs, you have the FMLA. You know, you try to protect yourself and your family. As a family, we all deal with it together. When Lloyd needs us, we're there. And we deal with it one day at a time. And whatever comes forth, we just take the best of it.
Earlier this week, I interviewed Keisha Little for this program. She is a sickle cell survivor and also an advocate. I interviewed her at Unity Hospital. That's where she has predominantly been for the past 2 months, dealing with complications. And she told me when she was very young, her mother was told Keisha would not survive past the age of 14. Next month, she'll be turning 36 years old. Here is a small portion of my interview with Keisha from earlier this week. So take a look.
As a child, I did not want anyone to know that I was suffering with this disease, because I felt that it was taboo. Even as an adult, like even as an early adult, I was a little bit afraid to even tell when I got into the workforce my supervisors that I had this, because I did not want them to fire me because I would have to take days off, or maybe they just did not understand. And so I came to a point where I said, you know what? I'm not going to live like this any longer. I cannot live in secrecy, because there is someone out there that's dealing with the same thing, and I want to be that voice for them if they can't be it for themselves. I know I stayed with my pediatrician until I had to get kicked out. So I believe I think it was either 18 or 21. I'm not really for sure. But I was the oldest one sitting in the waiting room, and I had no care in the world, because I had such a wonderful pediatrician, and it was so hard to find an adult hematologist that actually knew and could pretty much help me and speak to my needs. There has been times when I had just a family medicine practice doctor where he knew nothing, and he really did not know anything about sickle cell, and I pretty much was educating him on the disease. And when I experienced that, I said, okay, I have to find a hematologist. I would definitely love to clear up some myths that have been associated with sickle cell disease. And when we're in a crisis, we're not coming to the hospital just to seek out drugs or seek out, you know, the narcotics here. We are here to get medicated just because of the pain that we're going through. I feel like I can't even describe what the pain feels like because it's so excruciating. And sometimes what I can describe the pain as if someone took a jackhammer and just began to pound on your joints or begin to pound on any area of your body, and it doesn't stop. I try to manage it at home for as long as I possibly can before I actually come to the hospital. The hospital is my last resort. With Rock City Sicklers, we have a collaborative team of social workers, of doctors, and we also work with various organizations in the community, such as CURE, Childhood Cancer Association, and we have various various activities that we do as a group. And so it's not just sitting in a room, you know, every single week or every single month, just going around and sharing and telling stories. We try to incorporate fun things, and we try to incorporate ourselves within the community so that the community could also know what Rock City Sicklers stand for. We are warriors and we are survivors. And so this disease is not going to take us out, where the disease is not going to conquer us. It's not a death sentence, and you are going to survive, and you can function, you can work, you can do whatever you want to do. You can travel, you can, I mean, there are stipulations with that. Some people may, you know, not be able to work, or because going in and out of the hospital, or they can only work part-time, or they can only work per diem, but don't let it stop you. Don't allow this disease to define you.
Dr. Noronha, you're part of a statewide coalition working to get a bill reintroduced in the state legislature with focus on many things, but predominantly the development of sickle cell disease demonstration programs throughout New York. Talk about why you believe this is imperative, and also how this can help address this gap that Keisha mentioned when it comes to services for adults fighting sickle cell disease.
So, if I may, I just want to draw a very brief comparison between sickle cell disease and a very similar genetic disease called cystic fibrosis. Cystic fibrosis has gone through so many wonderful advances of treatment because they are so well funded. There are many private donors, and there was a study published a while ago that revealed that there's 6 times as much funding for cystic fibrosis in this country as opposed to sickle cell disease. And I don't know all of the reasons, but you know, I think that we need to close that gap. And there are many ways and many areas that we need to improve with regards to sickle cell care. And so this state bill will hopefully fund at least 8 treatment centers and demonstration projects around the state, and I'm hoping at least 1 or 2 in upstate New York, because we have quite a population of people with sickle cell disease in this area. And what I hope it would do is, 1, allow us to really focus on improving quality of care. And the divide between pediatric care and adult care arose because we've had such great advances in the pediatric phase of care that so many patients are now survivors, and that leaves you know, adult primary care physicians and adult hematologists a little bit unprepared because they really haven't, you know, been aware that these kids can survive. And so one project that we have in Rochester right now, which is helping to close that gap, is the Complex Care Center. And that is a primary care comprehensive clinic for all survivors of childhood chronic illnesses, including sickle cell disease. And the medical director there is Dr. Pulsino, with whom I work very closely. And that's one example of an initiative that I hope will improve quality of care for these folks.
Lloyd, I want to ask you, what are your hopes as you transition? I think anyone, you're 18 and you're moving, everyone looks forward to hitting those adulthood years. What are the things that you hope to do? And the things that you would say, you know, I will not be defined by this, and I will make sure that I pursue my passions and my dreams. What are those things that you want to pursue?
I want to go into the field of graphic design, and I'm not entirely sure yet. I'm still deciding, but rather it be comics or game design or drawing company logos, anything around that I'd like to pursue.
And Mom, as he does this, do you have any concerns moving forward as he transitions into that adulthood?
One of my main concerns, which by the grace of God, we have wonderful doctors, is his transitioning. It's kind of difficult at times, him being 18 and leaving peds, and it's scary as a parent. I just want him to have all the supports he can have, you know, through college. And like I said, a lot of education, you know, making sure they know what it is, basically working ahead of time. So if the situation arrives, we know that he has the backup. And as far as Lloyd, he's wonderful. You know, I know he can do whatever his mind sets him to.
Yeah. We have to close for now. We are out of time, and we could keep going, but I'd like to thank all of my guests for your time today and for your work in educating others and advocating for those with sickle cell. You should know September is National Sickle Cell Awareness Month. So to learn more or to get involved with the local group Rock City Sicklers, it's a support group and an advocacy group, be sure to check out their Facebook page. Just type Rock City Sicklers in the search engine at facebook.com. You can also call the group directly at 585-275-0798. The group's email address is also on your screen.